Welcome to CR Arthritis 2025. My name is Ellen, and I'm the Programs Coordinator at Arthritis Consumer Experts. Today, I'm joined by Karen Beattie. Dr. Beattie is the Research Manager in Pediatric Rheumatology at McMaster University. She is also the lead for the patient and family engagement in research at the Department of Pediatrics at the University of McMaster. So two very unique and very cool roles that we will get into. Karen, thank you so much for joining us on our program today.
Thanks for having me. It's a pleasure to be here.
Karen, your roles are so unique. Could you tell us a little bit more about yourself, how you're involved in rheumatology, and what is a lead for patient and family engagement and research?
Okay, well, three questions, so I'm going to try to answer them in order here. So unique roles for sure. I'm blessed to have these important roles at the university. Number one is working alongside the physicians in pediatric rheumatology at McMaster University and McMaster Children's Hospital to really make sure that the work that we're doing partners research, evidence-based medicine, and good clinical practice guidelines with the best of care that we can give our kids with arthritis, with lupus. And so I oversee most of the research projects that go on at McMaster. They're clinically based, so we get to partner with patients and do the best we can. And the focus of most of the transition at McMaster is really about supporting youth as they get ready to transfer from pediatric care to adult care. And so we have a lot of trainees that are involved in our research project and are very passionate about the topic of transition. The role of lead in patient and family engagement for the entire Department of Pediatrics is really about facilitating partnerships between people with lived experiences, whether that's an adult who is receiving care in the adult health system, whether that's kids and youth who receive care in pediatrics, and parents with lived experience. So it's really about partnering and networking people with lived experience with researchers. That might be non-physician or non-clinician researchers. It may be researchers in other clinical areas, physiotherapy, child life, and also medical doctors, physician assistants, really looking at how do we partner people with lived experience with researchers to make the biggest impact, to make sure research is relevant, and to make sure we have the right voices at the table.
It's an incredible role. I'm very excited as other universities, other institutions adopt these roles, and what our findings from what patient engagement, or in this case, family, community, clinician engagement can do to move rheumatology forward as a field. So such an exciting place to be, Karen.
Absolutely. Absolutely. And I think working and supporting researchers in my role, not only do I work with the people with lived experience and helping them to partner with researchers, but also really helping and supporting researchers in knowing how to partner with patients and families and people with lived experience, how to approach partnership in a way that is respectful, that's a mutually nourishing relationship, and is also trauma informed. I think there's a lot of really important work that we as researchers have to do in order to make sure that that any opportunities we have to engage and partner with people with lived experience, that those partnerships are mutually beneficial to everyone involved.
Well said. Yes, well said. Good for all of us to keep in mind. And with that, do you have any research projects that you're currently working on that you would like to share with us?
I do actually. I'm just going to share one kind of research area in particular that we're just finishing up because we're pretty excited about analyzing our data. And so Dr. Michelle Batthish was the lead researcher on two research projects that are kind of related to one another. And in both studies, we really looked at the there were feasibility studies or pilot studies. And for those of you who maybe aren't familiar with that terminology, I describe a pilot study or a feasibility study as really kind of a dress rehearsal or a practice run through for the big show, which is the big study. And so really we looked at how successful would we be at running a study that was focusing on supporting teenagers, youth, as they start to get ready and as they transfer from pediatric care to adult care. And the intervention that we had was transition coaches. So these were in both of the studies that we ran, we had healthcare providers who met individually, one-on-one, and virtually with teenagers, with adolescents, and talked through about 8 appointments over an 8-month period about different aspects of getting ready for transition. So helping the adolescents learn how to advocate for themselves, learning about their medications and knowing that and helping them be really knowledgeable and well informed about their own health condition, talking them through, what does life look like when you're in adult care? What are the differences between pediatric care and adult care? Then they also talked about things like ensuring you have all the information you need about alcohol use, about drug use, about safe reproductive health. These are really important topics that our adolescents need to know about. May not feel comfortable necessarily talking to their doctor about it, so having a transition coach to kind of talk one-on-one with them. And then the last part was really thinking about moving forward after you finish high school. What's next for you, and what do you need? How can a transition coach kind of help you in terms of, do you need accommodations if you move into the workforce? Or do you need extra support when you go to post-secondary education? Is there a student accessibility office? How does your drug coverage change? And so we ran a study where we had a randomized control trial, and some study participants got coached over an 8-month period, and some didn't. And we looked at the differences in the improvements in self-efficacy and confidence when they finished the transition period or the transition coaching period. And then we looked at the feasibility outcomes, which were, did the kids that participated in the study, did they like the study? Did they like the intervention program? Would they recommend it to their friends? Was there any part of the study that they didn't like that we need to change for planning the future study? And so we're just looking at our last data collection now, and we'll be ready to publish that. And so far the results are really positive. Certainly the patients that did receive coaching enjoyed it. They felt very well respected by the coaches, and they felt like their conversations taught them a lot. And they also can see how beneficial it is for other kids, which was exciting to hear.
I had the pleasure of actually interviewing Dr. Batthish 2 years ago when this was just launching. This was in person in Quebec, and it's really great to now be on the other end of it 2 years later and hear about the results that you're sharing with us. And, even at the time when Dr. Batthish was describing the intervention, I was like, wow, it really does fill a gap. As somebody who is a patient myself, who got their diagnosis relatively young, like, I think the saying, like, knowledge is power, it's only part of it. It's like knowledge and social support and guidance and mentorship and holistic health is power. Like, I would like to add those caveats, and especially at that age where they understand everything, right?
Absolutely. And I think, what we can look back and say as researchers, as people with lived experience who are older and wiser, looking back, we don't know what we don't know when we're 16, 17, 18 years old. And so trying to navigate a new healthcare system in the adult world, trying to navigate maybe college or university, and you don't even know what to ask. Did you even know that there's a center for accessibility that you could get potentially longer times to write exams because it may be difficult with arthritis in your hands. Are there, and if you don't know to ask the questions, then that's problem number one. And so a lot of what the coaching program did was a very individualized approach. They talked a lot about social stresses, about, you're meeting new people as you get older, and you're sharing information that maybe you don't want to share, or maybe you do want to share, and how do you have those conversations, relationship questions, new friends. And these are things that this population hasn't necessarily navigated before. And it's not always easy. And so empowering them with skills and confidence to be able to have these discussions or navigate these systems is really what the coaching program was designed to do. And one of the things we found was that all of the appointments that the adolescents had with their coach was at a time that was convenient for the participant in the study. So some of them had a conversation with their coach while they were at school on lunch break. Some of them would have it on the weekend. And that is also a personalized, individualized approach, is really critical to making sure that the participants get the most out of the study. Because if they can't attend a session because we've scheduled it at the wrong time because it's convenient for a researcher, then we're not going to have the end result that we want.
Absolutely. Yes. And Karen, I'm going to build off of this and ask, I know this year's theme for the CRA is Ascending to New Heights, Peaks of Innovation in Rheumatology, and it will be held in Calgary, really close to the Rockies, which I love the title. Can you tell us, so what are the next steps now that you have this innovation, right? What are the next steps of taking, to share with the audience, what are the steps of taking what we call a pilot study, dress rehearsal, to the full show? So how do we get from this stage to the next stage?
I think it's sharing the successes and embracing maybe what didn't work, or what we could do slightly differently. And we were very lucky to get great feedback from the surveys that we gave to the participants in the study to learn, would you like the same thing again? Would you do it again? If not, what would you change? And really building upon that, and writing the next grant that can run this study at many sites across the country, so that not just patients in our own site that benefited from the kind of practice run through can benefit, but kids or adolescents from different sites across Canada. And the other thing I think will be really unique in this particular study is that the transition coaches that do the coaching, either on Zoom or online somehow, or on the phone, they don't necessarily have to be located in the center where the study is occurring. So we can have patients from Halifax or somewhere in Newfoundland or somewhere in British Columbia, and they can still receive transition coaching, because what all of these kids have in common is much more than what's different because of where they geographically live. And so I think that's the next step, is realizing that this can benefit many kids, and we need to run the study on a much larger scale, and hopefully show that this is helpful, and that when they get to the adult world, that they feel a little bit more empowered and more comfortable in navigating a healthcare system and advocating for themselves.
I can't wait. I'm very
Me
excited.
too.
And do you have any self-care or self-advocacy tips for individuals, especially those living with juvenile arthritis?
I'm going to ask something of patients with juvenile arthritis, and that is, if research is something that interests you, because we only improve care by researching it. And if research is of interest to you, or if you've heard the word and you're a bit curious, reaching out and finding opportunities to partner with researchers so that you can help researchers ensure that their work is relevant to you, that it positively impacts your own health and the care of other kids. If you have that skill set or that interest, I would invite you, advocate for you to become involved in research in some way when you see opportunities, or if you're looking for opportunities. Because I think ultimately, research that involves the engagement of youth and parents produces results that are I don't know, better applied, better implemented to our clinical practices, and can really inform the best care.
What I'm hearing, Karen, is that they can play a huge role in moving research forward. And
Absolutely. Huge role. And I mean, we value them so much. Without them, we had patient partners, youth partners on the grant where we designed the study. Would we have designed it a different way without them? We would have. Would it have been as effective? Perhaps not. And we only learn that by talking to the youth themselves. And so if that's of interest to you, if you have the opportunity to engage with your own physician team or your own medical team and help them with their research, that is invaluable to us as researchers.
in that case, I will thank everyone ahead of time for forwarding this message on to any youth that they know who may be interested in engaging. And Karen, I want to thank you for sharing your voice, sharing your insights with our audience. And I want to thank our audience for tuning in. Remember to check out all the other episodes from CR Arthritis 2025. And with that, Karen, thank you so much for your time.
Thank you for the opportunity. I appreciate it.
Thank you to our audience, and goodbye, everyone.